Lots of patients or even your relatives will ask about seeing floaters and flashes. Floaters is common and could come with any shape, like rings, curly lines, and clumps. Most of the time it is due to degenerative changes of the vitreous, namely posterior vitreous detachment and vitreous condensation. The vision is usually not badly affected. You should always bear in mind the possibility of vitreous hemorrhage, retinal tear, or even retinal detachment. Now, I must stress that in some patient retinal tear or even retinal detachment, if the macula is not involved, they could still appear to have perfect vision, so be very, very careful. Vitritis is less common. There's also another condition known as asteroid hyalurosis. This is a degenerative condition of the vitreous with build-up of calcium and lipid. It is a common condition, but usually asymptomatic. Other rare causes of floaters include amyloidosis and tumor such as lymphoma. Patient may complain of seeing flashes. That's usually implied traction on the retina or something is stimulating the retina. So consider PVD, retinal tear or detachment, posterior uveitis, and tumor. Now for posterior uveitis, it is the inflammation of the choroid, and the choroid is very close to the retina. Patient might mention about flashes when they see some other strange light. We can call that pseudoflashes. Causes include ocular or CNS related. They are listed here for your reference. I'd just like to mention that patients with severe visual loss could also have some sort of visual hallucination. Despite the poor vision, they may tell you that they are seeing some funny image or strange light. This is called Charles Bonnet syndrome. Let's talk about PVD, posterior vitreous detachment, a very common cause of floaters. This is the separation of the vitreous from the internal limiting membrane of the retina. In the case of acute PVD, patient might experience a sudden onset of floaters and flashes. They are usually fine. Occasionally, it could lead to vitreous hemorrhage, retinal tear, or even detachment. In those cases, it might require laser or surgical treatment. We don't need to treat the floaters. They will be there, but the patient usually gets used to them. We will advise the patient to come back for urgent consultations if they see any new floaters. Now, we worry about retinal hole, tear, and detachment, and these are the risk factors that you'll be aware of, including history of retinal tear or detachment, say for example the other eye already have a history, family history of retinal detachment, high myopia, worse than -6 diopter, and also systemic disease such as Marfan syndrome. Retinal hole and tear can be treated by laser or cryotherapy, whereas retinal detachment requires surgery. Another possibility is vitreous hemorrhage. There are two important concerns about vitreous hemorrhage. Firstly, it is an alarming condition, and we need to look for the underlying cause. Common causes include acute PVD, bleeding from neovascularizations, and that could be due to proliferative diabetic retinopathy. Occasionally, it could be due to what we call a breakthrough hemorrhage from macula, some types of wet ARMD, say for example. Secondly, it is whether surgery is required. If the VH, vitreous hemorrhage, is there for too long, surgery may be needed. For your purpose, you don't actually need to worry about the indication of surgery. So, refer the patient to ophthalmologist. Examination-wise, we will check the affected eye for red reflex, dilate the fundi to look for the cause of vitreous hemorrhage, and if there's no fundal view, we will do a B-scan ultrasound to look for gross pathology such as retinal detachment. We will also check the fellow eye for other pathology such as PVD and retinal break, as well as other clues that could point to the diagnosis, for instance, hypertensive retinopathy and diabetic retinopathy. Treatment is conservative. Treat the underlying disease. Optimize the blood pressure and diabetic control for patients who have the conditions. We will also advise the patient to take some rest, avoid vigorous exercise, sleep with 2 to 3 pillows to allow the vitreous hemorrhage to settle down, and wait for the hemorrhage to resolve. If there's underlying conditions, we will also treat them, say for example, performing laser for patients with proliferative diabetic retinopathy and monitor the other eye for complication in case of diabetic retinopathy. And that's all you need to know about floaters. Thank you.